Hello, and welcome to Badger Talks Live, which brings exciting happenings, resources, and talent from your UW flagship campus to the people of Wisconsin and beyond. My name is Claire Durant. I'm from Sheboygan Falls, Wisconsin. I am a rising senior studying microbiology in the UW College of Agriculture and Life Sciences. Today, it is my pleasure to introduce Dr. Ruthanne Chun. Today, Ruthanne will be walking us through a previously recorded virtual tour through the UW Veterinary Hospital on campus. She will share personal stories of the outstanding, compassionate care consistently provided to hundreds of animal patients each year, and how her team has effectively adjusted operations since the start of the pandemic. Ruthanne is acting section head of medical oncology and a clinical professor of oncology at the UW-Madison School of Veterinary Medicine. She also serves as the Associate Dean for Clinical Affairs and Hospital Director of UW Veterinary Care, the veterinary medical teaching hospital of the School of Veterinary Medicine. She is the president of the Specialty of Oncology within the American College of Veterinary Internal Medicine. Please join me in welcoming Dr. Ruthanne Chun.
Claire, thanks for the introduction. It's really exciting for me to be able to show all of you a little bit of a behind-the-scenes tour of what's happening right now at UW Veterinary Care. You may know that UW Veterinary Care is both a specialty referral hospital, as well as a primary care facility. And of course, the reason why our hospital exists is because we are the teaching hospital for the School of Veterinary Medicine. And since the pandemic has hit us, we have not been able to have our students in the building with us because of concerns about them being able to be kept safe. And it's very important for our students' education that they are able to come back in the building, that they're able to have a hands-on clinical experience in our very well supervised setting. And so what we're excited about is our students are going to be joining us back in the hospital on July 6th. It's going to look a little bit different than what it's looked like before COVID. And as we go through the hospital, you'll see what a tight space we have, how it's very difficult for us to physically distance from each other. And so one of the things that we're all doing in the hospital is practicing what's called universal source control. So we're all wearing masks. We're all constantly washing our hands, wiping down horizontal surfaces, wiping down our computer keyboards and mouse and phone after we use them. So lots of different things happening inside the hospital, and outside the hospital, things are different as well because clients are not really allowed in the building. And we do allow clients in if somebody has driven for a couple of hours to get here. We do have a lot of clients that come from even northern Wisconsin, outside of Wisconsin, because of the specialists that we have here. So we do allow folks in to use the restroom, and then our staff have to go in and clean that restroom. And what we have in our parking lot set up are numbered parking stalls, so that when our staff know that a client has arrived, they can go out to parking stall number 17 and identify the correct patient and the correct client, get some information, safely transport the animal back into the building so that we can do our physical examination and any tests or treatments that might be necessary. So where we are standing right now is outside of our small animal hospital, and this is the main small animal entrance. We have a second small animal entrance that we'll see later in our tour, and that's where our oncology patients and our physical rehabilitation patients might come in. Also on our tour later, I'll show you the areas where our large animal patients come into the building. So let's go ahead and head on in. So where we are now is we are standing inside our small animal reception area, and we have our reception staff that are here in preparation for having clients and others in the building. We will actually have some plexiglass shields up for them. And what we're doing right now is all of our administrative functions are happening over the phone. So you can see our phones are busy, our staff is busy trying to talk with clients, get payments over the phone, and also get clients registered as they arrive with their patients. We're going to go ahead and keep walking, and I'm going to show you from this angle. You can see where some of our examination rooms are, and we're going to keep walking on down this way. This long hallway that we're on right now spans west to east, down the entire length of the hospital, with a small animal hospital being over to the north and the large animal hospital being over to the south. Kind of our first behind the scenes area. And as I mentioned, as we were standing outside, we have a fairly crowded space, and our work areas are smaller than what we would like them to be. Many of you might know that we are actually working on designing and hopefully soon starting to build a larger hospital. That was started long before COVID, but it's just something that we definitely recognize the need for during COVID because of the physical distance of 6 feet, which is almost impossible to maintain in some of our work areas. So as we go over to our left here, we have an area where our special species team works. Lots of computers. Right now, how folks are using computers is we are claiming a computer, wiping down the keyboard and mouse, and keeping that as our own workspace throughout the day. You can see we've got our wipes, our Purell, and trying to maintain a clean workspace so that everybody feels safe and comfortable. We're going to go just stop and look in special species. Charisma, is there anything happening that we can have a look at today?
We have a pretty full schedule. You can go in there and definitely take a look.
Okay.
Hi.
Hey there. Hey there.
We're tour through here really quick.
So I want to respect every client's privacy, and we're not going to show people's personal animals because just like if you were in the hospital, you might not want to be shown on camera if you were ill. But I think this is a really nice example of how crowded some of our spaces are and how important it is for all of us to be wearing masks and practicing that kind of universal source control, keeping each other safe. We do have a few patients that are in here, and we're since especially the special species animals oftentimes are prey animals, rabbits or guinea pigs or birds, parrots, we don't want them to feel threatened. So we're going to keep on walking and go on down the hall to the next area. So from this side of the hallway, you can see into our examination rooms. And all of our exam rooms actually have a front entrance and a back entrance. And when we're taking an animal from the exam room into one of our treatment areas, we say we're going to go out into the back. We would use this back door. Of course, there's no clients in the building right now, so these spaces are actually sometimes used as office space for some of our staff while they're trying to write discharge notes or other things. So the next area that we're walking past is actually our ophthalmology and primary care ward. And when I say ward, what I mean is essentially a workspace. And then we also do have kennel areas back in runs where animals might be housed if they were staying here for the day or even for overnight. One of the things that you can see here is actually some of the ophthalmology work that we, or some of the ophthalmology equipment that we use, and it's not often that you would see an ophtho rabbit-friendly labeled case that's got tools that we know we can safely use with a rabbit. The other thing that I think is something that is interesting for folks is we have these lift tables. And these lift tables are wonderful because for those of us that spend our lives lifting animals up and down off of a table, most dogs are happy to get up on this table, and you can see how slowly and smoothly it rises up. And then that allows the patient to be at eye level for its examination. So we're in one of our ophthalmology exam rooms, and you can see the equipment similar to the cart we saw in the other room is actually exactly the same type of equipment that human ophthalmologists use when you go in to have your own eyes tested. And so somebody would be holding the patient right here, and the doctors and the students would be doing the eye exam in the patient, actually in a darkened room so that they could see with their patient's pupils dilated. One of the other areas in the hospital that is key to our ability to provide outstanding care is our pharmacy area. And we actually have 5 pharmacists and, we actually have 6 pharmacists and 6 pharmacy technicians that work in here. Again, a very, very crowded space, so everybody's got their masks on, everybody's wiping down their areas, and certainly that's important whenever we're dealing with medications. It's also important to try and keep people safe and comfortable during the pandemic. And pharmacists have so much value added because they actually work very closely with our veterinarians and our technical staff to make sure that the drugs that we're using are not going to have side effects if they're combined inappropriately. They work to send out prescriptions to many of our patients who can't come back in because of restrictions on travel for various people. And another important thing about our pharmacy is not like a Walmart or a CVS type pharmacy. We provide prescriptions for patients of the hospital and not for outside groups, just because of inability to actually be able to service all of those clients. And just like many other hospitals or your own physician, if we haven't seen your pet for a year or 6 months, in some cases, like for patients that are getting chemotherapy, we're not able to send out medications until your animal comes back in for a visit. Shadow's person has agreed that we can see Shadow's cute fuzzy face, and so Shadow is in here in our small animal internal medicine treatment area. And Shadow's just coming in and going to have a physical examination done. You can see Shadow is very sweet. And in our small animal internal medicine area, we have doctors and nurses that are focused on medicine type problems. So patients with kidney problems, patients with intestinal problems or hormonal imbalances, would all be seen through the small animal internal medicine service. Yeah, that's a cute sweetie. May I say hi? She says, not really. I don't really want to say hi. You can say hi to everybody on Facebook. You're going to be famous. Okay. So we've seen our medicine area. We have a neurology team. We have a cardiology team. We have small animal general surgery and orthopedic surgery. And so we're kind of walking down the hallway, going past all of these workspaces. Right now our surgery area has got actually quite a few patients that are being worked on. And so again, not all of those people are okay with us showing their pets on screen. So we're going to respect that, and we're going to actually go in and have a look at the cardiology area. Can we come on in and have a look? Yeah. So our cardiology room has sort of 3 spaces. They have 2 rooms that they use to do echocardiograms, which are the heart ultrasounds that help our cardiologists understand what heart function and activity looks like. And then we have sort of a main treatment area. And you can see just from me standing in here how very crowded it is. We have some patient x-rays that are up, and we can see in here Dr. Rebecca Steffen is one of our cardiologists, and she is watching an echo actually, and doing some assessments and measurements on that as part of her daily work. And that's good news.
Look at this versus last November. Oh, yeah.
So here at the end of the hall, we have our ER triage space and our critical care facility. And the critical care facility is part of the hospital that has doctors and staff 24/7. And there are times when it's full. And I know in human hospitals with the pandemic, there are times when hospital beds are full because of COVID. Thankfully, although COVID has been reported to happen in cats and very, very rarely in dogs, we have not had one of those cases yet. If that did happen, we do have a separate isolation facility, and we can go have a look at those so that we know that those patients that have COVID can be treated while we're keeping other patients and the staff in the hospital safe. So right now, because our critical care unit is so full, we're not going to go in there and have a look. but know that that is an area of the hospital that there are people working 24/7. And because it's been such a busy, crazy time for us, there are times when if we don't have any cages, we have to say right now we're closed, and we can't have folks coming in. As soon as some cages open up and patients go home or are set into kind of lower care wards, then we'd be able to open up again. So it's hard for everybody, and we appreciate your patience with us. Let's go have a look at the small animal isolation area. So an isolation area does need to be separate from other areas of the hospital. We need to be able to keep patients isolated away from other animals. So that's why we're kind of going down this hallway to a back section of the hospital. What we're walking past actually as we go past there is our small animal anesthesia induction area. And you can see that there are 3 tables that are set up with catheters and clippers and tape ready to go ahead and anesthetize a patient. And it's another busy day for us. So this is our ante room to our small animal isolation facility. And right now our small animal isolation kennels are empty, but we can open the door and have a look. It's a pretty tiny space, but we do have cameras that can keep an eye on these cages while there is a patient in here. We have 1 large kennel down below and then 2 smaller ones up top, small work table. And so again, if we do have a pet that is positive for COVID or any other type of infectious disease, we can keep them in here and keep other pets safe, as well as, in the case of COVID, our staff safe as well. So right now we're standing outside of our dermatology workspace. Dermatologists, as you can see from the board here, deal with any kind of skin issues. And in dogs and cats to a lesser extent, when those patients have allergies, it's actually manifested in their skin. So anytime we've got a dog that is allergic to grass pollen or dust mites, that's when they might come in to see our dermatology service. And again, it's 1 small room for a very important service, and they do, one of the big things about dermatology is they really have to be detectives and try and help figure out what is it in this animal's environment that is causing it to be itchy or to have skin problems. So it's an important service, and certainly something that our students gain a lot from, because skin issues are a very common problem in small animals. And just next to our dermatology area is our dentistry area. And today the dentistry service is actually seeing patients, so they're not doing procedures on any pets. And so you can see kind of their work area. And behind one of our doctors there, she's working at one of our dentistry tables. There's a second dentistry table back there. And of course, when they are seeing patients, they can't be doing procedures. And so it's a quiet day for the workspace. And they're catching up on a lot of their computer work as well, and getting other patients scheduled in. We're going to keep walking down the long hallway here. So we're going to have just a quick peek in our radiology area. And these units might look familiar to you because they're really the same types of x-ray machines that are used in people. And so it's all digital x-rays. Patients would come in. There's almost always a minimum of 2 people in the room with the patient, having them lie on their sides or lie on their back so we can get different views, and be able to try and look inside at the heart and lungs or at the intestine or liver or kidneys, and understand what might be happening with a variety of different patients and problems. So we have 2 small animal x-ray rooms. So we got a little kitten whose mom has agreed to go ahead and let us see what's happening. And so we're going to have a little kitten time first, and then Kitty's going to get set up and have some x-rays done. Hey, can you tell us who this is?
This is Wednesday.
Wednesday says she's very worried about being here. Oh, honey. So we don't, she does. Not quite there yet. So Wednesday is a very cute little kitten who's coming in. She's going to have some abdominal x-rays. Yep. And so for a kitty like this, she's a little bit scared. We go slow. We talk to them. We try and use throughout the hospital sort of a fear-free type of animal handling so that we don't want to stress them more. Some animals, that means that they might even get some sedation from their people at home. That might be through a tablet that they take by mouth, so that they're just a little bit more relaxed when they come in. For a kitty like this, we would just go real slow. And if somebody's really unhappy, if the kitty's really unhappy or a patient is too stressed, that's when we actually would call our owners back and say, this is too hard. We need a little bit of sedation, and can we go ahead and do that so that it's not such a difficult process for them?
All right, Lindsay.
Okay, you want to go?
Come on.
Oh, she's purring now.
Okay. Just like any other X-ray technician, we have actually radiology technologists that work here, and we have CT and MRI technologists that work here as well. We also have an ultrasonographer, so human-trained staff that have chosen, because they love animals, to come and work with us. We're really happy to have that, and we're just going to show you how somebody might be set up to have an X-ray taken. And I'm going to get out of the way because I don't have my lead on.
She's still purring.
There we go. And so that's as easy as it is. So radiology is one area where once the X-rays or other types of images like a CT scan or an MRI, once those images are obtained, our radiologists can read them anywhere. So we can send those images securely to any type of computer. And so because of COVID, we want to decrease the number of people that are in the building. And so many of our radiologists are interpreting images from home. We do have folks that are here working because sometimes we need to have that immediate consultation. They also help when there is a need to have an ultrasound done. All good? We have some ultrasound rooms, and I'm just checking to see, and right now we probably shouldn't go in and bother them. And so what we're going to do is go through, you saw the small animal X-ray room, I'm going to show you a large animal X-ray room. So here we are coming into the large animal part of the hospital, and the first area that we see is our large animal X-ray room. They have this grid set up on the ceiling that helps the X-ray generator and the plate holder move wherever it needs to move, up or down or across, so that if we have a cow or a horse or a llama or a camel that might need to have X-rays made, we can get the machine up and out of the way, but we can also have it positioned so that it can capture whichever part of the body we need to. And from here, we're going to step out into the large animal hospital, and I'm just going to stop for a moment and ask the cameraman if he has been out of the country in the past week, and I'm going to guess it's no. But the reason why we ask that question is because of biosecurity. And so we worry certainly about COVID. Everybody knows now about travel restrictions because of COVID. In other countries, there are other infectious diseases that we don't want to come into our hospitals. Something like foot and mouth disease would be one example where everybody can understand that. And so whenever we have a visitor that comes into our large animal hospital, that's one of the first questions that we have to ask. Make sure that everybody's been in the country, and certainly this time of year, that's not a tough question to answer. In the large animal X-ray room, and we wanted to come out and show you the actual entrance to our large animal hospital, and it's actually called the Moriwa Large Animal Hospital. And we have both an equine reception and admitting area and a food animal admitting area. And those patients from those different types of species come in through different doors. They require different types of handling. They require different types of housing. And behind you, you can actually see that there's an exit gate. And if a truck pulls up to that gate, there's a weight sensor. And so then that will open the gate, the truck can pull through, and then the gate closes behind so that we can keep our patients in the right area. So we're going to walk on in and see the large animal hospital. And through in our reception area, you can see one of our receptionists working behind some plexiglass shields. And we are on the equine receiving side. The food animal receiving side is just over to our right. And this large unit right here is actually a scale. So we would have a horse or a cow or a camel walk across this, and you can see the readout that would show how much they weigh so that we can get an accurate weight assessment on them when they come into the hospital. We're going to keep walking on down past our clinician workspace. It's a nice area for our clinicians to work in. You can see, though, it is a little bit of a crowded workspace. And we're going to go on down and say hello to Ginger and Daisy. Ginger and Daisy are two cows that live here. They are retired from life as a dairy cow. And what they do here for us is they actually help provide either cow blood donations or cow rumen fluid donations, something called transplantation. And when a cow comes in and is very sick, sometimes the microbes inside that cow's rumen die off and they need a transplant. So our two girls, Daisy and Ginger, live here and help provide transplants for rumen fluid as needed. So we'll go have a look at, say hi to them. Dr. Burton is one of our large animal internal medicine specialists. And she might be able to actually tell us a little bit more about how, what happens when a cow needs a blood or a rumen fluid donation.
Yeah, so when they need, Daisy and Ginger are donor cows, and when they need patients' blood or rumen fluids, they generously donate their blood or rumen fluid. And not very often, but they need them. And you get the rumen fluid from the fistula in the side, which is easily managed, and the blood from, obviously, a catheter in the vein.
Somebody wants some attention.
They get to go outside. Usually they come in to be filmed. But yeah,
so they do live with the live with the fistulas in their side. It's something that does not disturb them, doesn't bother them. These girls are a little bit spoiled, and so when they see people or when somebody's here talking, they want treats, don't they? Yes, you're a big girl. You're a good girl. So Ginger and Daisy. And they do go outside and they literally kick up their heels in one of our exercise arenas. They don't like going outside when it's so hot, and they'll actually stand at the gate and moo to come back in. So they're happy cows. And there she goes. It's kind of a fun thing to get to see a cow scratching their back with their scratchy tongues. Other areas of the hospital that are sometimes interesting for folks to see would be we have a couple different surgical areas. And so here is one that we would call a standing surgical area. You can see that there's the stocks that are there to help hold a horse in the correct space so that it doesn't move around too much. Definitely these patients would be sedated when they come in here. You can see the surgery lights hanging from the ceiling. So this is one of the operating rooms that we use whenever you have a large animal like a horse or cow. Having them lie down under anesthesia, especially for prolonged periods of time, isn't necessarily the best thing for the rest of their body. So we try and limit the time that they're lying down, and if we can do surgery with a local block, so like you might get at the dentist, rather than under general anesthesia, sometimes that's actually preferred. We're going to come and say hi to Mocha right here. So Mocha is here as Mocha's owned, actually lives here at the university, part-time here and part-time out at a farm where she can be out on pasture. But many of our horse patients, because horses are herd animals, they like to have a companion. And so we bring Mocha in, and we have other horses that might come in to be companion animals, so that the horses that are here as patients don't feel quite so worried and feel like they don't have their herd with them. Hey, sweetie, you're a good girl. Good girl. All right, one other part of the large animal hospital that's pretty important and exciting for us and for our clients and for other veterinarians in the area is our standing CT scanner. So we're going to walk to the back of the hospital and have a look at that. All right, here we are at the far back of our large animal hospital, and we have a special area that was just recently redesigned, and that is for what's called a standing CT scanner. So this is specifically designed for horses so that we can image horse legs, horse limbs when they're actually standing up in a normal functional position. This unit can also swivel 90 degrees so that it can actually image a horse's head and neck. And that's fantastic for looking for dental or guttural pouch or sinus problems in horses. So we don't have a patient in here, which is probably pretty appropriate. We're actually catching one of our engineers here at the time where they're doing a software update. So they're just going to demonstrate for us how the CT scanner part rises up and down if we were scanning a horse's leg. So imagine a horse's front leg standing on that round circle. This piece of equipment actually is used for when we're using the instrument for a head or neck scan. So the horse is standing in this stock and it's slightly sedated, and then there's a trough just up there where their head and neck can rest, and then the unit can go through and scan their head and neck. If we just wanted to do legs, you can see now how that unit rises up out of the ground. And it's amazing how very quietly horses do stand for this. It's about 15 seconds up and then 15 seconds to go down again. So you can see that the limiting factor here would be how tall are that horse's legs and how high up can that unit go to scan parts of the horse's legs. They're actually going to raise it all the way up for us and then show us how this robotic arm can rotate the gantry 90 degrees so that if we did want to look at a head or neck, we could do that with this CT scanner as well. So lots of safety mechanisms that are associated with this type of unit, moving it, making sure that everything is okay before we would do a rotation like this. And my understanding, I am not an electrical engineer by any stretch of the imagination, but my understanding is that the technology, the type of CT scanner is very similar to what is used in an airport security setting. So the amount of radiation that's actually there is quite low, and we consider this to be state-of-the-art and very safe, while giving us images that we've never been able to see, and honestly, that nobody's been able to get before this type of unit was invented. And there we have it rotated 90 degrees so that you can see with the horse's head or neck in this trough how this unit could actually then come forward and scan over the horse's head and neck to get the images. So it's the machine that moves, not the horse. What you're looking at now as we walk down the hallway, this is actually an equine recovery stall. So when a horse does need to be fully anesthetized for surgery and then is waking up again, this is literally a padded stall. So there's a soft rubber on the floor, there's pads all the way around, and this is where a horse would be wheeled in on the surgical table, which is low to the ground, and then allowed to safely recover here in the stall and in this padded stall. Okay. We are now exiting the large animal hospital. And we're back actually at an area where we have our loading dock, and so there's a lot of equipment that might be coming or going here. We've got our reminders about how to keep ourselves safe here in the hospital. And what I'm going to do is we're going to pause and go to the outside so we can see the tomotherapy entrance and start from there. So here we are outside the entrance that is for our oncology and our physical rehabilitation patients. And we're going to go on in and say hi to the receptionist there and see who's in the back here. So if you've had a patient that's been cared for by our cancer team, this might be a familiar site for you. It also might be a familiar site if you saw the Scout Super Bowl, because that's where some of this care and reception happened. We're going to walk right past our rehab therapist. She does have a patient in there, so we don't want to disturb her while she's taking care of him. But physical rehabilitation for dogs and cats is much like it is for people. So animals that have had surgery that need to learn how to reuse a limb again, or animals that are getting older and have arthritic types of age-related problems would come in and see Dr. Courtney Arnoldy, our physical rehabilitationist. And we're going to go back now into our tomotherapy area. And we do have some patients that are going to be treated with radiation therapy today. Let's have just a quick peek at our tomotherapy vault, and we can see what that machine looks like. So the tomotherapy unit is actually, it's a marriage between a linear accelerator, a type of machine that delivers radiation therapy, and a CT scanner. And that addition of the CT scanner allows us to provide very conformal, accurate radiation to just areas that are affected by cancer and spares normal tissues. And so this is actually a unit that was designed right here on campus. And we are really proud to be part of the team that helped develop that type of technology. And this machine now, you're seeing probably one of the last public viewings of this machine, because in July this is going to be uninstalled, and we're going to get a brand new tomotherapy unit that will be up and running by September. So we'll look forward to having an even fancier type of radiation therapy machine to better treat our patients. And now we're just going to walk through the radiation therapy treatment area and past the planning rooms and see the medical oncology workspace. So a lot of patients in here today, and it's probably busy right now to come and have you all follow me in, but we do have one patient that her mom agreed to let us have a look at her and say hi, so why don't I go grab her? She can say hi to everybody, and we'll talk a little bit about what happens in medical oncology. So this is Annika, and Annika actually is interesting for a number of reasons. First of all, she's a very, very sweet tortie, and she's going to hide her face against me. Annika came through when we first met her in 2019 because she was one of the kitties that came from a rescue where we do spays and neuters for those rescues. So as our students are learning how to do surgery, we want them to learn how to do spays and neuters. None of our students want to have what we would call a terminal surgery. So we have animals that come from spays and neuters. So we have animals that come from rescues and shelters that are spayed and neutered by our veterinary medical students, and then go back to that shelter or rescue. The really wonderful thing about that program is that the students and the instructors that run that program put together flyers about every one of the pets or the animals that comes through. And Annika was so cute and adorable that somebody here decided they wanted to adopt her. So they've adopted her, and she is a very happy, loving member of their family. And unfortunately, Annika does have mammary cancer, and so that's one of the reasons why she's being seen here in oncology today. Right? You're good to go. Okay. So in addition to having our own pharmacy and our own radiology team, the other thing that makes our hospital so amazing and special is that we have our own pathology group right here on site. And that includes both clinical pathology as well as anatomic pathology. What's the difference? Clinical pathology is the team and the service that analyzes blood, urine, and feces, basically. And anatomic pathology would take a tissue sample and section that and look at it under the microscope. So they really give us a lot of very important information about what might be happening with a patient if there's an abnormal mass or growth. And we're going to just step right here into the reception area. And so you can see what happens in our lab area, which is we have hematology, chemistry, urinalysis, we have cytology, we have a microbiology area, and an immunology area. So it's a very busy unit. It's key because they give us the answers to so many of the things that we are trying to understand about our patients. And again, during COVID, everybody's wearing their masks, wiping down all of their surfaces that are touched frequently. And you can see right here, now we are not coming into ClinPath so that we can kind of decrease the traffic through this area and try and keep people safe while we're taking care of your animals. So that, in a nutshell, is behind the scenes tour of UW Veterinary Care. I'm so glad that you are all interested and willing to see what happens here. We do the best that we can during some pretty crazy times, and like you, love animals. And so that's really what brings us together.
All right, thanks everybody for watching. I am really so pleased to have had this opportunity to be able to share some behind the scenes views of the UW Veterinary Care Hospital. I would love to take any questions that you might have. I mentioned that our students are going to be coming back into the hospital with us in about on July 6th, and the veterinary medical curriculum is a 4-year program. So students go to undergraduate, most of them get an undergraduate degree, and then they come through vet school, again, a 4-year program. The first 3 years are primarily classroom and learning some of the skills that they need, handling skills that they need as veterinarians. The 4th year is where our students are getting their clinical rotations and getting clinical experience. And so we're excited to have them back. They would have normally started in May. So it's been a few months, and we're really looking forward to having them back in the hospital with us so that we can help prepare them to be out in practice and taking care of animals out there. I would love to, if there are questions, I know that Fran is helping out and is going to relay those through. I think one of the other things that has been really wonderful during this COVID time is to see how veterinarians are considered essential workers by the CDC. And the folks that work in our hospital take very, very seriously the fact that we are healthcare workers. We know how important animals are to people, both as companions, as amazing exercise buddies, as social networks for many people. And they're also such an important part of human health, not just from companion aspect, but from production medicine, care of food producing animals, and the dedication of the staff that I work with has been really humbling. And we do have an incredibly wide range of animals that we take care of. We have a special species group, and they are specialists in the College of Zoo Animal Medicine. And there's both a zoo companion animal, as well as a zoo, I'm not going to use the right term, but zoo animal, wild animal. specialty college. And so we do have a service that is called our special species and our Zoom medicine service, and they do see reptiles. Our vets do not make house calls, and that's actually part of the history of the vet school, is that when we were built back in the 1980s, there had been a many well-established clinics in the area, and we did not want to threaten them or their practices by having our veterinarians go out into the field. So we have clients that come to us. We do have some production medicine veterinarians that do help with production medicine aspects of veterinary care on farms around the state, but we don't do house calls to area farms. I see another question is, will clients be required to stay in the parking lot during pet appointments? For the foreseeable future, yes. We do know that as the weather gets worse, we're really going to want folks to be able to come in and be safe in our lobby and in the examination rooms. Based on CDC measurements and requirements, we're allowed to have about 6 additional people in our small animal lobby, in addition to our reception staff. So that's not many people compared to, on an average, about 100 visits a day from that we have throughout the hospital. So we are unfortunately not able to have clients in our reception area yet, and it's something that we really are trying to work towards. Thank you for the comment about pet oncologists. It is it's something that I'm very proud of being a veterinary oncologist, and I know that multiple of my own pets have had cancer, and it is a devastating and frustrating disease, but there are things that we can do, and there is hope, and not just for pets with cancer, which many times now we can treat as a chronic disease, but for pets with all types of disease processes. So it's really, it's a little bit like being a pediatrician in some ways, because those pets can't always talk for themselves. And we know that many of our clients feel like they're the parents of the patients that they bring in to see us. And we recognize how important that bond is to you. Any other questions from anybody else? I really do appreciate the chance to be able to show all of you some behind the scenes, to answer some questions, and to let you know that we do want to be here for you. And we're very proud to be a part of the school and serving the people of Wisconsin and beyond. So thanks again for the opportunity, and everybody have a good day and stay safe out there.